thank you so much for joining us this afternoon for the HOPE Consortium's conference on the Expression of Interest Survey. We really appreciate all of you taking out time to spend an hour or so with us to review the requirements of the expression of interest and to give you a little bit more information. I'm joined with my partners. I'm Sherry Killen-Stewart from the BUILD Initiative. I'm joined with my partners from Nemours, who you'll hear from later, and Boston Medical Center Vital Village, who you'll also hear from in a moment. And the three of us are really thrilled to be jointly funded by the Robert Wood Johnson Foundation to advance this work. What we'd like to do today is encourage you to use the chat box to put in questions. There's so many of you, there's over 400 people already on the webinar, that it would be difficult for us to open the line. But we encourage you to put any questions you have in the chat box, and we'll try to work in answers. We'll also review that chat box after the webinar and be posting a full set of answers, definitely after the 16th, but we may post iterative sections of the questions as we go along. And thanks to all of you who sent questions in advance. We'll be trying to answer those as we go through the webinar. But please use the chat box to continue to be engaged with us. We're going to give you an overview of the project, talk about the background, the goals, the opportunity. In talking about the opportunity, we will review the application. We know some of you had questions about what we intended in sections. And then, of course, we want to take any questions or reflections that come from you. Project HOPE is a consortium project between Boston Medical Center, Vital Village, BUILD Initiative, and Nemours Children's Health System. And HOPE stands for Harnessing Opportunity for Positive, Equitable Early Childhood Development. And so we can get a sense of who you are, because this opportunity is open to community and state, and you're not competing against each other. We'll be selecting a certain number of communities as well as a certain number of states. We'd like to get a sense of who is on the phone with us, so that you know, but we also know. So I'm going to give you a couple minutes to answer that poll question. Okay, let's see. So great. We're excited. Answers could keep coming in for a few more minutes, but about 63% of you on the phone are representing communities. We welcome you. We really encourage. Excited that you're here representing your community and your community work, and about 40% of you represent states. And that probably makes sense. There are a lot more communities than there are states. We want to do one more poll question to get to know you a little bit better. Where are you from in the country? So if you could fill that one out, that would be helpful. Because we're really interested in geographic diversity. We want states and communities and tribes to all be welcome to apply and participate. Okay, let's see that one. So about 25% of the people on the phone are from the Northeast, about 7% from the Northwest. The Midwest and Southeast are competing at about 24-25%, about 7.5% from the Southwest, and about 10% coming from the West. So that's important, and I believe there's at least one person representing Puerto Rico or other territories. So we really encourage you all to apply. We are really looking for geographic diversity as we move through this initiative. So when we think about the project, the work that we're doing together, our North Star is really that each and every child, regardless of race, neighborhood, family income, has equitable opportunities to achieve positive health and education outcomes. And we do that on the backbone of the Robert Wood Johnson Foundation that really wants to enable children and families to have equitable opportunity, that really believes that some communities, some neighborhoods, some families don't have the opportunity to have the same level of optimal physical, social, and emotional well-being. So that's the thing that brings us together, really making sure that each neighborhood, each child, each family, regardless of race, has equitable opportunities. And we also believe as a partnership that the child is nested in a whole family and community, and so we can target initiatives and target our efforts and make programs of service to children, but that we have to understand the context in which children grow and develop, which is family and community. And we also believe in the strength of community and that families are best positioned to design the solutions. And so we want to work with local coalitions and state cross-system teams to really design solutions that include the voice and create a feedback loop between families and community stakeholders. We really believe that there's an unequal distribution of power and resources, and that unequal distribution leads to factors which limit the growth and development of young children and families. And so we're asking you in applying for this grant to partner with us to learn together in a network, in a community, how communities and states can redistribute that power and resources so that we expand opportunities for many young children and their families. Because we believe when that doesn't happen, what you see is communities, neighborhoods, sections of states with concentrated poverty. You see trauma and racism, which have lasting impact on children's well-being. And we experience inequities that start early in children's lives, prenatal to 5 is our span, and significantly impact their growth and development later. So we put that in 5 goals. 1, we want to promote optimal health and well-being for children prenatal to 5 so that we prevent and mitigate early childhood adversities and improve adverse social settings by reducing racial, ethnic, and geographic and economic inequities. And all of these goals are listed in the call for proposals. We also want to strengthen or realign systems. That's the policy, the funding, the governance, the practices, the programs, initiatives, so that they are targeted towards places that need them most, where there's the largest disparities and potentially least opportunities or historical inequities. We also want to engage community members with lived experience and really create authentic feedback loops to ensure ongoing communication between the state and local policymakers, practitioners, community leaders, and families. And we want to use and are bringing to the table peer, state, and community mentorship and technical assistance to really increase the capacity of states and communities to address these large issues such as poverty, institutional structural racism, and other aspects of childhood adversity. We really want to improve the ability of states and local communities to have and work towards shared interests and goals through feedback loops that use data and stories to really monitor not our intentions but the impact that we have on communities and states, looking at our policies, our regulations, our programs, and our practice. In doing that, here's what we expect. That in the long term, we'll really see increased opportunities and improvement in child, family, and community well-being. In the intermediate, we want to see health and early learning and public health and health care working together to coordinate and collaborate across agencies so that we increase access to state programs and services by shifting our policy, funding, and regulations. And we also want to build and increase community capacity. And in the short term, we really want to increase knowledge about early childhood systems, racial equity frameworks, as well as develop cross-sector state or community teams to really work to advance this work. So with that, I will turn it over to Renee to talk to you about the opportunity. Renee?
Good afternoon. I'm Renee Boynton-Jarrett from BMC Vital Village Network. Thank you, Sherry, for the wonderful overview of the opportunity, and I'm delighted to talk a little bit more about some of the definitions that we're using. So the Robert Wood Johnson Foundation defines a culture of health broadly as one in which good health and well-being flourish across geographic, demographic, and social sectors. So by fostering healthy, equitable communities, this can help guide public and private decision-making and make sure everyone has the opportunity to make choices that lead to optimally healthy lifestyles. So the opportunity we're excited to offer as the HOPE Consortium is that up to 7 states and 8 communities will be selected. Selected communities will be invited to apply for grants of up to $80,000 to work in a learning community for up to 18 months. Selected state teams and individual state leaders, survey respondents will be invited to apply for 7 state grants of up to $200,000 each for up to 24 months. Who's eligible to apply? We're seeking community-level coalitions that are cross-sector, as well as initiatives and networks, as well as state-level coalitions that are cross-sector, or individual state leaders who have the ability to form a state team over the next 2 years to explore how to improve child outcomes, address inequities, and to support systems change that improve child health and well-being. For the existing community-led coalitions and state-led coalitions, they may have already defined the outcomes and approaches to address inequities that they're working on. So you're welcome to apply if you are a state leader who will form a team, or if you're a state with an existing coalition or a community with an existing coalition. Project HOPE Consortium is offering several opportunities within this time period. Membership in an active national network that is focused on early childhood and well-being promotion and cross-sector alignment, workshops, technical assistance and training, access to model policy and or support defining or revising policies, the opportunity to engage and work with federal, state, regional, and local community leaders, access to current research, expertise, and as well as support for the development of data and data stories. The selection criteria include the following. First, a history of effective collaboration across sectors to address child well-being and inequities. So an important part is to demonstrate an existing capacity or the ability to create a backbone infrastructure, and that includes staffing, data systems, and organizational capacity to support collaboration and cross-sector work, as well as to collect and share data for the use of program planning, decision-making, and tracking progress, to be able to respond to changes in political climate and other external factors. Essential to this is the use of an equity framework and a commitment to addressing inequities, racial, ethnic, geographic, socioeconomic, at the level of the community or state through alignment and collaboration with other sectors and leaders. The second selection criteria is around leadership and goals, an indication that Project HOPE goals fit with current goals of state or community leaders or community or state level coalition. Evidence of the ability to create and align systems approach to early child well-being. In that, we're really looking for more than 2 sectors to be involved: health, public health, education, child welfare, social service, community organizing, community-based services. This is designed to address inequities. An existing strategic plan, whether it be formal or informal, or the willingness to create one that is aimed at tackling child well-being and health inequities at the state or community level in partnership with diverse sectors. Next, Engagement and geography. Engagement. So authentic incorporation of stakeholder voice, community members with lived experience in the development of policy, practice, or programs. So engage in diverse children, family, programs, communities who have experienced inequities in child well-being and health, seeking to amplify and respond to diverse providers, children's families, and communities by aligning community and state-level systems. State or community work that are in 2 or more child-serving sectors, improving state and community capacities to promote equity in child and family well-being, whether it be through communication systems and feedback loops between the state and local government, as well as improving, measuring, and tracking benchmarks of civic engagement and progress. Final selection criteria is around geography. We're hoping that we will have a diversity of states and communities represented, as well as a mix of region, rural, urban, racial ethnic diversity, and Native American communities. Now I'll turn it over to my colleague for the next section.
Hi, good afternoon, everyone. Rochelle Payas with Nemours Children's Health System. I'll walk you through the general application process, which is on an online platform. Also, I'm having some technical difficulties, so if someone else could move the slides forward for me, that would be great. I have them in an alternate version. Going on to the application sections. For those of you that have accessed the application system, you will find that information in the opportunity announcement email or on projecthopelaunch.com. Once you're in that system, you will see that this is a survey format. We're asking applicants to provide some general application on who you are. You'll also be asked to provide information and type of application if you're applying as a state, team, or at a community level. And there are certain sets of questions that go along with each of those sections. We want to know more about who you are as a leader at the state level. Within a community, please describe your coalition, how you're working together. Once you get some basic general information about you all, we also are interested in what your goals are as your state team or coalition for advancing child well-being and health.
Rochelle, can you pick up the phone because people are having a hard time hearing you?
Oh, okay.
Is this better?
Thank you. Yep,
Sure,
thank
no
you.
problem. Excellent. On the goals section, we are particularly interested, as Brene mentioned previously, around a focus on inequities. And we want to know more about how inequities are affecting the outcomes, the desired outcomes for young children in your area. As possible, we want you to provide a brief update or evidence on data, stories, or other documentation that support your concern. Again, as been emphasized previously, we are interested in knowing about the coalitions or groups or managers that you work with who have authority and responsibility for supporting and guiding your work, as we want them to be very involved in this process. Also, we want you to start thinking about what your biggest strengths and challenges are around your specific work. Okay. At the state level, we are asking for teams, minimum of teams, two-member teams at this point. We do want the teams to grow over time and representing different programs in health, healthcare, public health, and early learning, child welfare, early intervention. You'll see that there are several categories provided in the survey. And at the community level, we are interested in learning more about if you have a backbone organization available to support this effort. And what we mean by backbone organization is the group that will really help coordinate this effort over the life of the project. Next slide. Here I mentioned backbone organization. We have a few sections where, if possible, we would like to know about a project coordinator, if that person has been identified, and also team members at the state level. Again, if that information is possible by the time you apply. We are asking for information around your team. As I mentioned, we want to know what agencies they're working in, what sector. We'll also be asking about race, ethnicity, and gender, as we are emphasizing a focus on equity. And finally, around infrastructure as well as coordination and alignment, we want to know more about what's going on the ground in your community or state in terms of having a key cross-sector coalition or group focused on young children. And there are a series of questions related to the type of work that might be going on, if there is the existence of a formal or informal strategic plan and vision with goals and objectives. And the next slide, just highlighting some dates, surveys through the online system. Again, is available at projecthopelaunch.com. That'll give you the access. You can register, start your application, and go back in later, but everything must be completed by March 9th, 11:59 p.m. Eastern. The partners will review invitations, the submissions, and then a next phase will follow with invitations to apply for interviews or site visits. We're still defining what that process will look like, but it'll be around March or April. And then finally, we're hoping for the selection of the state teams, leaders, and community coalitions around the summer. I think that's all. And for more information, which is the next slide, there's the 3 main contacts for each of our organizations. And you can also email questions throughout this process at projecthope2018-2020 which we are checking daily. Thank you.
Thank you so much, Rochelle, and thank you, Renee. And we've had a few questions come in, so I'm just going to have us answer them. But one question, Renee or Rochelle, is how are we asking people to coordinate with HRSA or Maternal Child Health Title V? Rochelle, you want to take that one?
I think that's something that we're going to have to get back to later. We don't have a formal answer for that yet.
But we are encouraging people to have as many partners as they can, especially in their state. Yeah. Another question that came in is a match required? Renee, you want to answer that? Maybe she's on mute. So there's no monetary match required?
There are not matching funds required.
Right. Thank you. Sorry, Renee. But we are asking you to commit time. And so you'll see in the application at a couple different points we're looking for, who's on the team. We want this to be a part of the work that you're already doing and committed to. And so it's not another project but helping you to advance your work. But there, time is money, while there isn't a financial request required. It says, another person asked, are you hoping the state matches the grant with other resources? So we've talked about that. Let's see. Is the Project HOPE open to any state? Rochelle?
Yes, it's open to any state.
Yeah, and we also are encouraging the territories and Native American communities to apply as well. We've also had the question, could 3 states join together and apply? And we believe the answer to that is no. We're really focusing on coalitions from communities. The community can define itself. Renee want to say more about that. But we are looking for the state team to come together and not across state teams. Renee, do you want to say more about the definition of community?
Yep, we have some details on the RFP and in the glossary we included. However, it's just important that the community is not required to be a certain number of people or geographic size, but you do have to have an official way of defining the region within that the region within which you're working, as well as the way in which the coalition is organized or the local initiative or network is organized.
Thank you. And we've got my favorite question came in from Diane. It says, assuming that some communities have a great need but aren't always in the best position to apply for this type of funding, is there additional help to assist those worthy communities complete their applications? And the consortium has thought about this, and that's why we have a two-step process. Step one is to be able to clarify who's the lead, fill out the information that Rochelle went through. But that's not the point that we make the decision about the funding. There's a phase two that Rochelle mentioned where we would be engaged, and that will sometimes include interviews or another application. So I think I would encourage communities that you described, Diane, to do their best filling out the application and giving us that information. But this isn't the only step in the process. There will be another step where they may feel supported. Rochelle or Renee, did you want to say anything to that?
I completely agree. I think the expression of interest survey is meant to provide very basic information, and then the next step in the process there will be many more opportunities to work together in a supportive way.
I agree. Rochelle. We're really seeing that as our opportunity for you all to share what's going on in your locations, and using that information, then we'll take a deeper dive later.
We also got a question, would an individual leader at a national nonprofit providing technical assistance and capacity building across states be eligible? And sorry to say in this case, no, that this is really designed for state leaders and cross-state teams as well as community coalitions. So it's not really designed for a national organization. Somebody wrote in and said, can this grant be used as leverage for other work, that they are working on Help Me Grow, and they wonder if they could use this grant to kind of catalyze that effort? Rochelle?
I think one of the questions we ask in the expression of interest survey is about how you are partnering with other work that is occurring in your local area. So we're very well aware there are many initiatives happening on the ground, and we're interested in how this would fit in to the nexus of that work.
Thank you. Another question is, does this grant fund staff positions to do the work? First, I'll start by saying this is not the stage where we're asking you to give us the budget about how you would use the funds. But Renee, you want to talk about what your expectations are once selected?
We are expecting that both for community level, that there's both a community champion who would be identified, if not already, as well as a local project coordinator, and that their time for working on this project and in the learning community would be compensated through the grant. So it would, when we get to budgets, it would be a requirement that some of the budget be spent supporting the time of staff as well as a community champion.
And George is saying, we assume you'll select only a few communities or states. Do we have any idea about how many we would select based on the survey, or how many we would interview? Rochelle?
Well, we do know ultimately we are aiming to work in 3 states, and we will be working in a 4th state in partnership with Build and Vital Village.
But I don't think any of the partners have limited the number of people they're willing to interview or talk to after the survey.
No.
We're using that to narrow the pool. You'll have to be in. We hope you're in that pool for us to make the selection, but we haven't picked a cut number.
Exactly.
And for full transparency, we have both external reviewers as well as an internal review team for the expression of interest surveys. So it's a formal review process with both external and internal reviewers.
And we're getting lots of questions about the budget, and I just again want to make clear that at this phase is not the money decision. We're trying to find the right partners that are interested in doing the work that's aligned with the goals and outcomes that we shared with you, and that the process of determining who gets the grant and what the budget is spent on are things that will be done in a second phase. Michelle, you have any? This was a good question. It says, will the consortium partners provide on-site TA, or should we be thinking about building in TA in their proposal? Renee, or
for the communities, there will be on-site TA provided, as well as some in-person convening of the different community sites where TA will be provided. So that will be built in, that we will provide. Mm-hmm.
Yeah, and for the state level, that's our approach as well, that we'll be providing on-site. And I think when we get to that point, as Sherry mentioned about budgeting, we would consider folks budgeting for some TA within their sites as well, depending on what their needs are.
Somebody raised the question about, are there explicit outputs or outcomes that be measured? For sure. Each of the partners is being held accountable to laying out a logic model and a way of thinking, but we also are very clear that when the state and the community comes to the table, it kind of adds to the stone soup. So there are a set of measures that we've committed to. We've shared those big goals. We've shared this big idea that we want to decrease disparities and decrease inequities for young children prenatal to 5 in targeted communities where they live. But how we do that and the measures on the process to getting there is something that we'll co-create with communities and states. I don't know, Renee or Rochelle, you want to add anything to that?
I just want to emphasize we really believe that measurement has to be defined at the local level and has to be useful to the local community that's going to be using them. So within our broad domains, there's a lot of flexibility, and very important that the community be heavily involved in determining the measures.
And Kate's saying it's confusing, like what is the budget really going to be used for? And it'll be determined based on the communities and states that are selected. From the state perspective or the bill initiative portion of the consortium, we want the investment to be something that advances the work, but the work needs to be sustainable. And so I think, again, depending on the state, we'll be talking to them about how could they use the money to really advance the work. I think we've talked about data and data analysis, gathering and bringing people together, things of that nature come to mind quickly. But do either of you have answers about that? What would the budget be used for?
Sure. Well,
I agree.
As alluded to earlier, sorry Renee, will be around, we'll support some staffing, some level of staffing to move this work forward. Could also support convenings, possibly needs assessment, different activities that need to happen within particular state. It's hard to give a lot more specifics because we do want this to be very state specific and to meet your needs. But those are some of the big categories that we're envisioning that the funds would support.
Yep. I would add just microfinancing of innovations at the community level to enhance existing work, supporting of time for engagement in the action labs and planning process and convenings, as well as to support the building of systems that can help support capacity to move the work forward, sustain, and scale the work.
We got a question from Rachel. Can a community coalition or state leader apply from the state? The answer to that is yes. And the state doesn't have to coordinate or figure out the community. The community can apply and the state can apply. And if you happen to be in the same area, that's great. But there's no need to do that work to do this letter of interest at this point. We hope that there are states with communities in them working on the work. In fact, we intend to try to hopefully some of that will happen. And then Tom said, just to be clear, will there be 7 states who will be awarded funding or only 7 states invited to apply? There are actually 7 states that will be funded. But we may invite more to apply to get down to the 7. Somebody else asks, can teams be built within the organization, or should it be from multiple agencies coming together to form a team? And the answer is we're looking for a cross-sector team, people that aren't in a reporting relationship with each other. We're trying to support children prenatal to 5, their families and communities across a multitude of issues. So we expect the team to be from different child and adult serving agencies. We know in a lot of states that many of the parts of early childhood have been brought into one department, but there's usually some component of health, public health, health care that sits in another department. So we're really looking at cross-state, across departments. Rochelle, do you have more on that?
I would just echo that. We are interested in looking at cross-sector and cross-agency, ideally.
And we got a question, would multiple applications from the same state be considered? And I think that the issue here is that we hope there's a cross-state team that's working on a multitude of issues. I imagine if 2 different cross-state teams got together and applied, we try to figure that out. But in the end, we probably only selecting one state team in a state. Is that right, Rochelle?
Correct.
You went out.
I would agree that that's my understanding as well. There's a couple of other questions. Someone asked, can an academic institution in collaboration with multiple sectors apply for the community grant? Yes, the academic institution I think should qualify as a 501c3. The lead applicant has to be a 501c3.
And somebody else asked, when filling out the application, how many of the team members need to be included in the application? So I know we want to be very clear about who the lead is, who's doing the applying. You don't have to put the whole team in, and if you're applying as a state, you can upload. If you've got a coalition that's already meeting, you could upload that. But we just want to get a sense of the diversity and inclusiveness of the team if possible. But you shouldn't feel like you have to, spend a lot of hours creating a team for sure. So, 4, 5, 6, 7 people is sufficient when you're describing who's on your team. Renee, is your answer for the coalition?
I'm trying to find that question. I don't see it. How many community coalitions will be funded? There will be up to 8 funded. We will be able to fund a state and local community within that state. That is correct. I know there are a couple of questions where people are trying to understand who from each state is on the webinar right now. We do not have a process right now for gathering that information.
There was a question, can a state and 1 or more communities apply jointly, or are separate applications preferred? I think at this point we expect separate applications from the community and from the state. You're happy at the bottom of the application says additional information that you want to provide. You can let us know that that application came in from a community or from a state if you're the other.
Mm-hmm. Someone is asking, are we hoping a collaborative entity such as a network be the lead applicant or an agency? Either is fine. If an agency is applying at the community level, you have to reference the network or coalition you are a part of that would be doing the work.
And we're still getting the question, would you select a community and a state from the same state? We hope that we can find state cross-system teams and communities in the same state to do this work together, but you don't have to come in together. Renee, were you going to say something?
There is a question about how many communities within a state could potentially be selected. We have not limited it. We do care to have a diversity of states and communities. It's unlikely more than 2 communities within a state would be selected.
And there's a question, is participation in out-of-state meetings required? I can answer that. Most likely we will bring this peer network together 1 or 2 times a year, but I can't tell you when and how many meetings because those will depend on who the states and communities are and the work that individuals will be doing together.
That will be a requirement for the community coalitions.
Right, to participate in out-of-state meetings?
Yes.
Okay. And then somebody asked, will the applicants be penalized if their leadership team is not very diverse? No, you're not penalized for not being diverse. You should talk about that, especially as it relates to the children and families in your communities and what you might do to diversify the team working on this process. So noticing it is job 1.
There's a question around age groups. So does the coalition have to focus on early childhood only, or can you focus on multiple ages? The scope of work for the project has to connect to prenatal to age 5. So if you are doing work with juvenile delinquency, there has to be an aspect of the work that is connecting to that early childhood piece. So that's the emphasis of the work.
And Diane points out that she thinks it would be great if a local coalition and a state coalition were working together, and that is our hope. There's a question, Renee, this is good for you. Can the money be used to strengthen existing coalitions?
Absolutely. We are expecting for community-level coalitions that they are already in existence. At the state level, you can be a state leader who has the ability to start a new team or coalition, but at the community level, we are requesting that there be a primary relationship already established.
And then there was a question, will TA be provided by Vital Village, Nemours, and Build, or might other TA providers be brought in based on the focus or the need of the community or the state?
I can answer part of that question. Across our HOPE Consortium, Nemours, Build, and Vital Village, we are working together to be efficient around TA where it makes the most sense, particularly around the feedback loop between states and local communities. For the local community, we have several existing partners who will support TA, including our strong partnership with Brazelton Touchpoints and the National League of Cities, as well as ROSE. So we have several partners already involved, and there are several others.
And yes, you may get technical assistance from any of the 3 partners in the consortium, or if the need is outside that, we will be happy to bring other folks to the table. It's about supporting and advancing the work. And we've said 3 and 7 and 8, and then people have gotten confused. We're funding 7 states. And Renee, how many communities?
8, up to 8.
Up to 8 communities. And here's a question. For people that are brought in as staff to work on positions that can be covered by funding from this grant, will the hiring process be at the discretion of the lead for the grant, or would you have specific requirements that you would expect anyone hired to follow? And again, I think that's a budget question. I'm not anticipating any expectations, but that's a budget question for Phase 2, unless, Renee, you have a different answer.
I am not anticipating their expectations. The community champion and project coordinator will be determined by the local coalitions.
And the same goes for Nemours as well. In general, when we've done efforts like this in the past, we don't oversee the hiring process. That's left to the discretion of the partner. And then somebody asks, is there a shareable document with the desired outcomes of the proposal?
At this point, you should really depend on what's in the survey of interest. And as we narrow down, we'll be, of course, working on and sharing and even co-creating some additional information. Somebody said, are we sharing this at the AmChip conference this weekend? I'm not going to AmChip. Renee, you in?
I'm not. We will make the webinar available, the recording of the webinar available on the website.
And we encourage you to get the information out to AmChip partners.
There is a question about what constitutes a community, footprint size, number of residents, etc. We have not made requirements about that. We do want to be very fair and equitable so that rural, urban communities can apply, and coalitions that have formed and define their community focus differently are open to applying. So it is just important that you're very specific in the survey of interest.
Beth wanted to know, are we looking for extensive coalitions or few cross-sector partners with a clear focus? Any sense of one being better than the other? Renee, I think that's...
Could you read that question again? I'm sorry, I couldn't.
Yes.
I don't see that question.
Are you looking for extensive coalitions or few cross-sector partners with a clear focus? Do you have a sense that one is better than the other?
This has been asked in two different ways. I think someone else asked a question regarding the focus of their work on early intervention as well. We are interested in the emphasis on improving and achieving equity in the focus of your work, as well as the focus on child's well-being. So that can be scoped a variety of ways. We do have a very specific framework around culture of health and the whole child model, but we have not made limits on it having to be a specifically narrow focus or specifically broad focus. It should be in the lane of the work that's happening.
This is a question from Hannah. Are you hoping for a specific focus on content areas like early childhood mental health, or a broader focus on system building across content areas? And it's really both and. I mean, we really are focused on building early childhood systems, but those systems build and are strengthened by focusing on targeted work. But that targeted work has to be fed both by data around disparities and inequities and voice from communities and families. And then she also asked, are we looking to build on existing work and foster efforts where historically not much may have happened? And again, I think that's both. We're looking for a diverse pool of states and communities, and in some instances you may be building on existing work, but we certainly are very interested in targeting communities and families where historically there may not be much, especially when those communities by data demonstrate disparities, inequities, and poor outcomes for children.
I would completely agree. We are looking for diversity, and most important is really just describing the level of readiness your local coalition is at right now for what next.
And Stephanie asks, are we looking for teams to focus on a range of issues or narrow in one or two? I think we're looking for strong teams, and that each of us through the process will be supporting you to focus and narrow. But I don't think, I'm sure you don't need to figure that out now. We do ask you in the application if you've got a strategic plan, if it's got any focus around this area. We're interested in that, but we're not at this point asking you to laser in on this is the thing, because that may not be fully informed by community or families or the data. At this point, we're really looking for strong teams or interest in building strong teams across sectors, and then the process will help narrow the focus. Rochelle, would you add anything to that?
No, totally agree with that, and we're also looking to hear from you what makes the most sense. This is an opportunity, and I think you should also take into account time. The project period is going to be a little less than 2 years, so it depends where you're at as a state or even a community, what you think is feasible, whether it be a range of issues or narrowing on on one or two. We're really looking to you to hear what makes the most sense.
And Rachel, yes, a government organization can apply as either a state or if it's a local community coalition. I imagine they would be the lead or backbone. Is that right, Renee?
Yeah.
They could be.
Funds will be distributed to the recipient team. They will be subcontracted from the separate organizations in the HOPE Consortium. And the question around the top section of the survey about history of work in early childhood, if you are applying as a state leader, that reflects your personal history. If you're applying as a community or state coalition, that reflects the history of the coalition's work.
And then somebody asked, I think you've answered this, Renee, but does the coalition need to already be in place to apply at the community level?
At the community level, we're looking for coalitions that have already come together.
And
so
then
an application from an anticipated to be coalition is not what we're seeking right now.
And then somebody said if you're applying as a community coalition, but there's also a state one, will the community be penalized? No. The review process for the communities and the review processes for the state are separate. So we're actually looking to find a state and a set of communities that may be embedded in each other, but you don't have to figure that out at this point. We encourage you to get your interests in, and we'll do that clarification in the second step. It says how many communities within the state could potentially be selected. And it's no more than 1 to 2 if the number's 8. Yeah. Could a state advisory council apply as a state entity? I don't see why not, Heather. You'd have to fill out the rest of the criteria and let us know how your plan is and what's the authority and who the leads are. This is from Marjorie. She says, does that mean that you would potentially help connect coalitions who are community-based with statewide applicants? Yes, in the second phase. It doesn't have to be done up front. Will resources such as workshops be provided to funded teams individually, or will some workshops be provided to all the funded teams? Rochelle?
There's going to be diversity. It would be a diversity.
Right. It'll be a big, and it's dependent on what people are working on.
Exactly.
I just wanted to review the eligibility criteria. Oh, sorry.
No, go ahead.
I just wanted to review the eligibility criteria for fiscal agent. The fiscal agent for the state leader or state community team must be based in the United States or a U.S. territory. It can be a public charity, educational institution, nonprofit organization that is 501c3 tax exempt, a state, regional, or local public agency or organization, or a tribal group recognized by the U.S. federal government.
Then we also got a question, Renee, this is for you. Do all members of the community team need to be nonprofit entities, or will public and private coalitions be acceptable?
Public-private coalitions will be acceptable, but the lead applicant cannot be a private entity.
And this is a good question, Rachel, and we may not be able to answer, but if multiple applications come from the same state to the Project HOPE, would we bring them together? It's possible. I mean, we have to look at that in the review process. And then this is if states with multiple communities with the same state are applying, will you encourage them to work together as one applicant? We're looking at the communities and the state separately, but a lot of this work is about feedback loops and connection with communities. So regardless of what state is selected, we're going to be asking them to look at and select targeted communities to work with. So I think we have about 6 minutes before the time is up. I think we want to really encourage you all to email one of us. If you've got a question, you should email the Project HOPE email address, because we'll be getting answers out. If we haven't gotten to your question here, we will include it in the frequently asked questions. Again, there's several budget questions here that we're just not able to answer at this point, but other questions we will get back out in the questions and answers. And we really do encourage as many communities and as many states as possible to apply for this opportunity. We're really appreciative of the Robert Wood Johnson Foundation for bestowing amongst us the opportunity to work with all of you. If you know us as agencies, this is what we do every day, and are really privileged to have the opportunity with these resources to continue to advance that work with you at the local level and at the state level, and especially us working together. Renee, do you have any closing thoughts?
I would just echo your comments, Sherry. Thank you all for your time. We will make sure to respond to the questions that have not been responded to thus far.
And Rochelle?
Thank you, everybody, for joining us today. Again, we do encourage you to apply, at the very least to check out the survey and let us know if you have more questions, because we are very excited about this opportunity to work with you all.
Thank you so much. And again, this is an opportunity that's made available to state teams and leaders and available to communities. They are not in competition with each other, so we encourage communities to apply and we encourage states to apply. It's a two-phase process, so get your information in and we will review them, and certain states and communities will be invited to apply for the second phase. But we really encourage you to express your interest and let us know what you're thinking, and more important, let us know what you're doing in your community and state on behalf of young children, their families, and communities. So thank you on behalf of Bill, Nemours, and Vital Village, and we look forward to reading your surveys of interest. Thank you.